The time is exactly 8:42 a.m. We do apologize for the late start to our next interview. Unfortunately, a bit of a technical glitch on our side. Hopefully, we have sorted it out. And thank you for your patience, Professor Darelle van Greunen, Professor in the School of ICT at the Nelson Mandela Metropolitan University, also Director of Center for Community Technologies. A very good morning to you. Welcome to the show. And I do believe you have some good news for us as far as COVID-19 is concerned.
Good morning, Julie, and good morning to the listeners and the viewers, and greetings from a balmy Rebecca this morning. Yes, we have some good news. There are some easing of the restrictions, and it seems as if we have exited the fourth wave of COVID. So we can start looking forward to returning to some form of normality, whatever that may mean. But yes, good news.
Okay, so that obviously talks directly to discussions we've been having, or the entire country has been having, regarding children back to school, safety precautions as far as they are concerned, their exposure, social distancing, masking, etc. How does that then all play out? Undoubtedly, I mean, I too have noticed in my social circles that people have become very complacent, very relaxed. I went to a wedding this past weekend, and not one person, myself included, guilty as charged, not wearing masks. So we were very relaxed and it was almost back to normal. How's that all going to play out? What sort of restrictions, however minimal they might be, what are the restrictions that will still be in place?
I think, well, let's start with the children. And I think it's very important that the restrictions have been eased around education and children in particular, because we know that there has been many, many challenges for children, not only academically, but also socially, and not being able to participate in events as they were used to, and engaging at a psychosocial level as well. So that's very important for the development of the children in going forward. I do believe that we need to still encourage parents to have their children vaccinated. I think from the stats that we see, not that many children have been vaccinated, and maybe there's been some fears around that. And we now know that it is really very, very safe for children to be vaccinated. In terms of the bigger picture restrictions, I think we would still need to emphasize the non-pharmaceutical interventions. So, the sanitization, the wearing of masks, etc. I think we could see some relaxation on the screening at entrances into the workplace or into facilities. I've noticed this past few days that the different hospital groups and public, private sector, they've all done away with screening of patients or visitors to the facilities at the entrances. With the Omicron, we know that the symptoms are much milder and you can be asymptomatic. So therefore, those kinds of things have been done away with. But the wearing of a mask and sanitizer will probably still be with us for a while. I think, and I'm preempting what may come, that we may have mask wearing eventually as optional. If we think back of swine flu and all of those, how that was eased as we went along. So I think we can expect something along the same lines.
Okay, traditionally here in South Africa, around about March, April, we start our big flu vaccination drive. People that have got their boosters, or people who haven't even been vaccinated for COVID-19, but possibly regularly do go for their flu jabs, would that still be recommended?
Absolutely, yes. The most important part is to keep your immune system as strong as what you possibly can. So I think what is important also, from the interventions and the precautions that we can take. So still go for your flu jab, take your vitamins as you do on a regular basis, and ensure that you stay as healthy as what you possibly can. Um, Look, COVID is not going to disappear overnight, but it's going to become eventually part of our daily lives. And when we think about it, we've become accustomed to taking the flu jab and the likes thereof. So we really should also exercise those precautionary measures that we've always taken as we go into the March, April season, and of course going into winter as well.
Absolutely. Professor Darelle van Greunen, we thank you for your time. We do apologize that it's a short interview, but because of the technical hitches, undoubtedly we'll talk again sometime soon. Go well and stay safe.
Thank you. Same to you. Stay safe. And everybody else, please remember, wear your mask and sanitize. Important to
Abs-
do.
Absolutely. 9:48 exactly. News and views right here on Salam Media. An ad break, and then we'll be joined by Mike Bolhuis, a specialist investigator.